Okay, my name is Sammy King and I'm going to demonstrate a piggyback and monitoring of an IV. Any other situation I would have my full scrub set on, but I came to Sydney this morning with 2 pairs of pants and no shirt, thinking that I had the full set. Anyways, the first thing I'm going to do is, this is my MAR, and so I'm going to wash my hands, and then I'm going to verify the 6 rates of medication. Right patient, right route, right dose, right time, right documentation. Right patient, right route, right dose, right time, right documentation, and right medication. So the first thing I'm going to do is look into the MAR, and it states that I need to administer chloroform 560 milligrams through IV piggyback every 8 hours, placed in a 50 ml normal saline solution and infuse over 45 minutes. So my drop factor is going to be 62 mils per hour and 1 drop per minute is what that's going to be. So the first thing I'm going to do, so I verified with my MAR, and then I'm going to, we'll say I'm in the patient's room, and I'm going to check my patient's wristband for 2 identifications and make sure I have the right patient and the right medication. So I'm going to take my 50 mils of normal saline, and I'm going to check it to make sure that there's no particulates, the expiration date is good, I have the right solution, and everything looks normal and good here. The next thing I want to do is draw up my medication and put in here, but I need to do a medication label, and so the medication is going to state the drug, which is the chloroform. The amount is 560 milligrams. It's going to be added in 50 mils of normal saline. I have my date and my time and the expiration date. So I am going to put that on here. So I am going to draw up 560 milligrams. Excuse me. Of chloroform. Okay, so there's my 560 milligrams. Excuse me. Okay. I'm going to dispose of this, or actually I'm going to leave that on there because I need to hook up my piggyback. So the next thing I'm going to do is hook up my piggyback. We've done this 50 times. Okay. I'm going to add my medication. And then I'm going to do the one-handed scoop method. Okay, and then this is going to go into a sharps container. Okay, so since my medication's in there, I don't want to shake it. And now I'm going to hook up my piggy bank. Okay. Remaining sterile. Going to connect those two. And I'm going to close the clamp all the way. And then this is to be higher or I need to do this. Pardon. So I'm going to want to I'm sorry, this thing was much different than what was in my kit. Jeez. This was not in my kit. Oh, I need to just put the big bag on this. Okay, that makes sense now. I'm like, okay, I apologize. I mixed that up because that wasn't what I was used to. So, okay. So the next thing I'm going to hook, I need to drain or fill my medication in this tubing. Okay, and I did that. And then the next thing I'm gonna do is I'm gonna hook it up. And it's closed. These both are closed. So I'm gonna do to the closest port that is easy. I'm gonna remain sterile here. And I primed my tubing. So I'm gonna go ahead and hook these together. And then I need to fill this up halfway. Okay. And now I'm going to, my little bag is closed, and I'm going to open up my big bag and watch the drip factor on the big bag. So open the little bag. It's all the way, but I need to watch my drip factor on the big bag. So I'm going to make sure that it is 1 drop per minute. So I'm going to make sure I'm going to open the big one, but I'm watching the drop per minute on the little bag. in any other normal situation, I would understand this blue thing and get it correct. So I apologize. Okay, we're about half a drop at 30 seconds. So I'm monitoring and it's 1 drop per minute. And then the next thing I'm going to do is I do have this strip placed here from my previous video, and I needed to monitor where it would be at the time. So I do have my medication strip. The next thing I'm going to do is I did my 3 verifications. I'm going to document in the MAR of my medication that was distributed and the time and whatnot. And then I'm going to teach my patient the properness, checking for phlebitis or any redness or irritation or whatnot. And I'm going to make sure that he doesn't like bump the tubing or anything like that. And so I just want to make sure that he understands the proper, and then I'm going to document all my documentation of what I've done. And I think that's everything.